Hi, my name is Dr. Malin Hultcrantz. I work at Memorial Sloan Kettering, the myeloma service, and we, myself together with Dr. Aklagi, have reviewed some of the data on racial disparities in smoldering multiple myeloma. So what we did is that we reviewed all the smoldering patients that have been diagnosed and followed at Memorial Sloan Kettering between the year 2000 and 2019 with follow-up to 2021. We identified 576 patients, of which 13% were African American. Then we looked at the progression rates in these patients, and we did see that the African American population did have a lower risk of progression. So the median time to progression in the African American population was around 10 years, 9.7, and in the white population, it was 6.2 years. These patients did have a similar risk profile. So using the Mayo 2018 risk score, they did have the similar risk profile. However, the African American population, they were younger. They had a lower median hemoglobin level and lower degree of immunopoiesis. So due to this age difference, we actually stratified patients to be younger than 65 and those that were 65 and older. And in the younger population, we saw that the risk was actually similar between the two groups. While in the older population, that's where we saw the bigger difference, where the African American population had a longer time to progression, median 9.8 years, while in the white population, it was 5.2 years. So what this means is that we do see that the African American population with smoldering, they do have a lower risk of progression. We know that MGUS and likely also smoldering is more common among African American, but we do see that the risk of progression is actually lower. We also know that if these patients develop multiple myeloma, given that they have the same access to drugs and same access to healthcare, the prognosis is actually better. There are some indications that the African American population have a higher degree of the lower cytogenetic risk profiles, so hyperdiploidy and the 11-14 translocation. So there may be many factors playing into this, socioeconomic factors, susceptibility, but also possibly genetic and genomic differences. And there are large ongoing sequencing studies. So we're looking forward to eventually putting all this data together to know more about the risk profiles and possible racial disparities in both MGUS and smoldering and multiple myeloma.